Good morning. Thank you for joining me for this update as it relates to Jacksonville's COVID-19 response and our recovery efforts. Joining me on this call this morning or on this press conference for questions is Sheriff Mike Williams, Fire Chief Keith Powers, Emergency Preparedness Director Steve Woodard, who will be available for questions when we conclude the briefing. As of this morning, the Florida Department of Health is reporting a cumulative total of 2,112 COVID-19 cases in Duval County, 307 hospitalizations, and 59 deaths. Out of the 73,000 tests performed, we have a positive percentage of 2.8%, down 3.5 points from our peak of 6.3% on April 6th. As reports of positive cases have come in the past few days, my team and I have heard the concerns of many residents who fear that the virus may be on the rise. That is not the story the data is telling us, so I want to help put some of those fears to rest today. It is true that our numbers of positive cases have increased, and that was to be expected as we know the virus is with us and people are out moving around, getting back to work. We've focused considerable efforts on increasing our testing capabilities here in Jacksonville. A month ago, my administration began work on appropriating $35 million in CARES Act funds to support increased testing. I'm appointing Dr. Charles Moreland on my team to lead COVID-19 testing efforts as we continue to increase testing capacity throughout our city. His experience as a former fire chief and first responder make him uniquely qualified. As we've rapidly expanded testing, we knew cases would increase. The governor, as part of his efforts to protect our most vulnerable citizens, has teams throughout the state aggressively testing throughout assisted living facilities. Where there are outbreaks in those facilities, those numbers are being reported in bulk, and this is adding to the recent increases throughout our state as well. While the number of positives is an important number to watch, I've said all along, what my team and I are watching is the percentage of positives. This data point more accurately shows the prevalence of the virus in our community. That number has been steadily decreasing for months now. But we're also watching hospitalizations and rescue transports. When we put our work from home and safer at home orders in place, it was done with the intent to protect our healthcare systems from the crisis we saw in places like Italy, where they ran out of space and equipment at their hospitals as cases spiked beyond control. We have flattened the curve in Jacksonville, which was always the goal, and our hospitals are no longer at this time facing that kind of risk. Hospital capacities have returned to pre-COVID levels over the last few weeks. As of yesterday, we had 46 COVID-19 inpatients in our hospitals, down from a peak of 80 on May 28th. Additionally, the men and women at Jacksonville Fire and Rescue Department have seen significant decreases in COVID-19 alert cases. Those are calls to 911 where the patient is exhibiting symptoms of the coronavirus. The peak for COVID-19 alert cases was 34 on April 13th. Yesterday, on June 15th, we had 2 alert cases. For the last 10 days or so, COVID alerts have hovered around 1 to 2 per day. We've also seen a decline in the number of positive COVID patients transported by our Jacksonville Fire and Rescue Department. While the data is improving, we cannot afford to be complacent. The virus is with us, and we all play a part in protecting ourselves, our family, and our neighbors. While it is unfeasible to quarantine indefinitely, we must not be reckless in how we reopen our city and our economy. We must reopen safely and responsibly, and that's what we're doing in Jacksonville. I continue to ask people, I ask you to take personal responsibility and make wise choices as we fight this virus. Consider wearing a mask in a public place. If you're in a store where it's dense and there's a lot of people, please wear a mask. Frequently wash your hands, sanitize, and continue to practice social distancing where possible. The key to protecting our friends and neighbors and loved ones is to behave safely and responsibly. While we continue in phase 2 and much of our city is back to work, I know the financial impact this virus was an unexpected hit for many of you. With the help of CARES Act funding, we've been able to assist citizens and business owners with tens of millions of dollars in direct financial assistance. I'm happy to share with you today that this assistance continues with the launch of yet another grant program. This Saturday at 8 a.m., we will begin taking applications for the Senior and Disabled Financial Assistance Program. This will be a one-time payment of $300 to Duval County residents age 72 or older, or any resident who's receiving Social Security disability benefits. There's only one payment per household. In order to qualify, you must not have received funds from the city's 5-Star Small Business Program or the city's Mortgage, Rent, and Utilities Relief Program. You must have experienced a reduction in income or an increase in expenses due to COVID-19. And your adjusted gross income may not have exceeded $30,000 in 2019. More details on how to qualify and apply will be released later today in a detailed press release. I'm grateful to my colleagues on council for their collaboration on this program, particularly Councilman Aaron Bowman. We also know many people in our community are having difficulties with their utility bills. Council members Salem and Boylan are working with my administration to provide additional financial assistance to those in Duval County who face disconnection of utility services. We will provide more updates on this program later this week. Before we close, I want to once again thank the healthcare workers, first responders, grocery store employees, and all essential workers who kept our city running these past few months. You've made us all proud, and with that, we'll take questions. Jim with News for Jax.
Hi, Mayor. A couple of questions on here. I know you said you're looking at percentages. Today, we had 80 new cases, one of the biggest spikes that we've seen in some time. People are scared. They're really thinking that this is a problem. And then we're talking about bringing in the RNC, bringing in more people into this community. How can you justify that? And what do you want to let these people know that, is it safe?
Yeah, Jim, thanks for the question. Indefinitely quarantining is not, it's not an option. There were financial outcomes there that were hurtful to people and families, additional health outcomes that were negative. People weren't going to the hospital for necessary things. The virus is with us. When this started months ago, the international and national call was to flatten the curve, to protect hospital and healthcare systems. And we did that, and we need to continue to be vigilant here in Jacksonville. But I said when we went back to work, as long as the virus is with us, we're going to have to focus on those that compromise immune systems, assisted living facilities. Those most likely to end up with a positive result that end up in the hospital in a life or death situation. And that's what we've got to continue to do here. We're testing more people. More people are out and about. So with more testing, coupled with that, there are more cases. But our hospitals and our transports are declining. They're not increasing. So my message to people is, if you are an at-risk person or have an at-risk person in your family that you spend time with, you need to take extra precautions. You need to be responsible for that. If you don't, you should be in public when you're in a grocery store or a convenience store. Be responsible and disciplined enough to wear a mask to care about those people around you. And as far as it relates to events that are coming through the summer, including the convention, that's 2 months out. We're going to plan as we're open for business. It's the time to plan as though we're open for business, and you adapt at the time given the health risk. Here's what I'll tell you about the convention. There will be the right protocols as people coming in, temperature checks, et cetera, and the right protocols in-house to make sure that we have a safe, responsible environment. Bridget with Action News.
Hi, good morning. Can you hear me okay?
I can.
A couple questions about the RNC. There's businesses that are coming out, particularly at the beach bars, other spots in Jacksonville, of employees, customers that have tested positive for coronavirus. You said in a press conference, I believe last week, that if we do see a spike or if we continue to see, more cases coming out that are concerning, that you would adjust. Could you tell us what that adjustment would be as far as the RNC is concerned. And then second question is the TIAA Bank testing site that is downtown. That's going to be in the middle of everything that's going on. Do you have plans on possibly moving that? And then last question, as far as money is concerned with paying for the RNC, how will you be transparent with the city? Is there going to be a database for people to track money that is spent, whether it's federal or wherever that money is coming from, so people know what is being spent and where it's coming from?
There's a lot of questions there. The first question was how do we adapt as case? The behaviors that we need to be taking right now are the behaviors that we've been preaching for weeks, and that is be responsible, consider wearing a mask in a populated place, practice social distancing when you can. If you have people in your family or you have a compromised immune system, you need to be extra responsible, take extra care of what's coming and going from your household. But the hospital, the COVID-19 hospital cases are down. The transports are down. So I would ask the media to be responsible and communicate to people that that was the goal. Don't move the goalposts, okay? If some in media are suggesting that we should be quarantining because there's positive cases in our city, that suggestion is ridiculous. People would be out of jobs. People would have to face other health risks. So my commitment to the people of Jacksonville is we watch hospitalizations, we watch percent of positives, we watch those that are most vulnerable, and we have to learn how to live with this in a safe and responsible way. The other questions were testing. I'll let Director Woodard take that in a moment. And as far as spending on the Republican National Committee Convention, let's make sure, I've said it before, let me say it again. There's a private host committee that's a nonprofit, non-political organization that will raise private dollars to put on this convention. The city will have some responsibility for public safety, which is a reimbursable expense from the federal government. And so as we work with our federal government and plan for this convention, we'll share details with you as we get them. We're literally days into this decision being made, and our sheriff and our sheriff's office and others are working with the federal government to secure those resources and secure those dollars as well. Director Woodard, did you want to address the Lot J testing during an event?
Yes, sir. Thank you. We understand the importance of Lot J in that location, and Lot J has been very successful. We've conducted over 25,000 tests there. So we're working with the state to relocate that to a convenient location, and that should occur in the very near future, and we'll keep you updated on that.
Thank you. Megan with Action News.
Hi, I have a few questions for the sheriff regarding the push to defund the police. And I know that this was talked about yesterday, but with Trump's executive order supposed to be coming out today, are there any thoughts on the national push to defund the police? And I believe it was said that 40% of the city budget is for the police. So does it make sense to keep it that way? Can they take care of 40% of the problems in the city? Some people say no. So what is kind of the response to that?
So, yeah, thanks for the question. So the idea of defunding law enforcement agencies around the country, to include ours, is probably one of the worst policy ideas I've ever heard. I tell you that there may be other, and there are other needs in the community in terms of, delivering services to the community, but I certainly don't think you take it away from law enforcement to be able to do that. So, in terms of our budget, 85% of our budget is salaries and benefits. Any cut to our budget means laying off police officers. That's the last thing you need to do in our city. And, the 40% of the budget, I think if you look around the country and let's make comparisons to other cities, you'll see a similar percentage. It's a big part of any city's budget, to provide police service to a community. So I'm sure we'll continue to have these discussions, but yeah, I don't think that that defunding the police or however you want to say it, I know the verbiage is changing, is a smart idea.
AG with Florida Politics.
Mayor, quick question about the HRO signing. You said you evolved on the federal monuments issue. I want to know if you evolved on the HRO also, and what that means for the convention. Also with the convention, Mike Pence said there were assurances made regarding a full-scale convention in Jacksonville. Are these assurances actually made? Can you guarantee such a convention is going to happen? Thank you.
AG, first, are you a shot out in front of us? Anyway, I like your background. And I don't know if you're actually out there or if that's your room. And that's, as it relates to the HRO, I've signed the current bill, and given where I am today, if I were 2 years ago, I probably should have signed the bill. In fact, I should have signed the bill 2 years ago, but I've signed it, it's law, and I'll do what I have to do to protect it. As it relates to the convention and assurances, we have told the Republican National Committee convention that given the trends that we have and the health protocols that we have in place and will be able to put in place, both at entry points and in the building, that we'll be able to have a full-scale convention. That's where we're headed, and that's what we expect. The governor said this before, and I'll say it again. Nothing in life is certain. If things change, if this virus takes an unexpected turn, we'll adapt accordingly at the time. But we are planning in accordance with our trend lines right now, and that is getting people back to work, protecting the vulnerable, protecting our healthcare systems, and trying to get back to life to normal in a safe, responsible way. Mark Woods with the Times-Union.
Can you hear me?
I can.
Hello? Okay, thanks. I guess it's kind of following up on what AG just asked. You've said we won't know where we'll be with coronavirus in August, and that's obviously true. As it stands now, the CDC and other public health officials say the highest risk of transmission would be large gatherings, people coming from all different places of the country, indoors, without social distancing, which obviously basically describes what convention could be. If that's true in late August, would you still advocate for filling the arena to capacity, or do you plan to support doing that no matter what?
Following the logic of not planning events because the CDC guidelines suggesting that large gatherings are the most risk, those guidelines are going to exist until we have a vaccine, or until the virus is no longer with us. So if you follow that to its logical conclusion, cities just wouldn't plan any events. There'd be no events planned. We would just pretend like there is no getting back to some sense of normal. We have trend lines and data points that demonstrate that we've flattened the curve, that we're protecting the most vulnerable, and that we can gather in safe, responsible ways. So at this point in time, we are planning a convention at the arena with protocols, entry points, and in the building. But with any public health crisis or any public crisis, that public safety issue we have to face as leaders, we're not going to put people at risk if conditions change. But right now, we're planning with the data points that we have, and that is to have the proper protocols coming in for testing, for temperature checks, and once you get in the building, to have the proper protocols in place to keep people safe. So that's where we are at this point in time. Lauren with News for Jax.
Mayor, let's talk about long-term care facilities for a second. Signature Healthcare of Jacksonville has 18 deaths. That makes up 30% of all the deaths in Duval County in just that one facility. I know it's not under your purview, but has your office reached out to this facility specifically? And what is being done to make sure that these facilities are still keeping up with what needs to be happening to our most vulnerable?
Sure. So I'm going to have either the fire chief or Director Woodard follow up on this, but there is a focused effort on these facilities. It's been demonstrated those are the most vulnerable for spread, one of the most vulnerable. It's why Governor DeSantis, when he was being attacked and criticized early in this process, he was actually focused on those facilities that are the most vulnerable, and that focus continues under his leadership in conjunction with support from our city. So with that, either the fire chief or director can follow up on specificity of that question.
Yes, Mr. Mayor. We've worked closely with the Department of Health. I was just on a call with Dr. Roll, and we talked about the nursing homes and long-term care facilities. Those continue to be areas that we focus on because those people have traditionally been the most at risk. They did, within the last month, testing of all residents and all staff at all long-term care facilities, and continue to work with those facilities to ensure that they're safe for the residents.
Mike with the Daily Record.
Yes, hello, Mayor. You mentioned proper safety protocols once people are into ViStar Arena for the Republican National Convention. Can you talk a little bit more specifically on what those protocols will be when you have an arena that's full capacity? And then also, can you get a comment from you in regards to we've seen some hotel chains or some hotels locally, some larger hotels that have had some temporary and permanent layoffs recently. Do you feel that the hospitality industry in Jacksonville is going to be able to staff for the RNC and have enough personnel to handle an influx of people? And then one final question: have you been given an estimate from the RNC as to how many people actually to expect in Jacksonville for the event?
The first question was a lot of questions there. You guys are hitting me with like 3 and 4 questions. What was the first part of that question, guys? Oh, protocols. Well, look, the convention's months out. We know some basic protocols that we'll have to take, such as temperature checks, who and when to test people. But we have health experts that will be working with my team as we begin thinking about what the inside of the arena will look like. And when we have more on that, we'll share it with you. We're creating it. Again, guys, we got awarded this convention days ago. And so now the planning has started to do it in a safe, responsible way. And then what was the other part of the question? Go ahead.
Yeah, Mayor. So with some hotels locally recently with layoffs and permanent layoffs, how can they handle the capacity for the RNC?
Yes, and if we don't get back to some form of events and open up hotels, those people that were laid off will never get their jobs back. So this is going to be a economic driver for sure. Last question, Alex with First Coast News.
Hey, Mr. Mayor, thank you. Just one question for you. And looking at numbers out of Charlotte, looking at numbers in Jacksonville, we see the same sort of ebb and flow, but your confidence level seems much greater than the mayor of Charlotte, who made that decision a while ago about the RNC. What's your level of confidence and the logic that goes in with that obviously he wasn't seeing?
Look, I wasn't in the negotiations with the RNC in Charlotte, but my understanding is this was driven by the governor of the state. This was not driven at the local level. You guys could drill down on that from a journalistic perspective, but my understanding is that there's a number of elected officials in Charlotte and a number of businesses that are incredibly disappointed that the governor of that state would not work with the RNC for an event that they had planned for over 2 years. That's more than 2 months out. Seems to be incredibly political. That being said, because of that, we have the opportunity here now, and watching hospitalizations, watching transports, and encouraging people to act and behave responsibly as long as the virus is with us and we don't have a vaccine. With that said, I'm going to close and again remind people, look, it's been weeks, and I know many of us, it's easy to get lax when you're out. Wear a mask. Consider wearing a mask if you're in a indoors populated, you can't properly socially distance. Wash your hands. Make sure that we are caring for the most vulnerable, compromised immune systems. If you have somebody in your family that is vulnerable for infection and hospitalizations, you should be acting at another level of responsibility. Thank you.